Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, you wanted to talk about thoracic pain today, single best, most effective exercise for thoracic pain, something like that.
Right, or the mid-back.
Mid-back.
Okay,
yeah.
so let's use Bonaparte here. Our skeleton.
Right.
If we're looking at the spine, a little quick education of the spine. We got the C-spine, there's 7 vertebrae
Right.
there. We're going to go down here, 5 vertebrae here are the lumbar spine, and 12 vertebrae in the middle, thoracic spine or mid-back.
Right, or on Brad, it would be from right here again, his neck stops here, his low back starts here, so right in this whole area right there.
Right, so if you're experiencing pain in that area, and a lot of people I think get this if they're at a computer workstation, seated, a lot of seated things, or
Exactly.
Yeah.
You got it from your bike.
Right,
Yeah.
exactly.
He
'cause
bikes a lot.
I got a road bike, one of those kind that you hunch over and it looks like they're not very comfortable, and sometimes they're not.
Okay.
So, this is what I found with myself and a lot of patients, is you need something to reverse that arch in your back that gets you rounded over. And at home, you can take a towel or a few towels like we did here, and you roll them up pretty tight.
Really tight, as tight as you can.
So you get a round form here, and we got duct tape there to hold it, because you need it round and you need it to stay that way. So Bob, can you lay on that?
Sure.
So he's gonna lay on it in that thoracic area of the spine. You know, let's get the pillow out of the way. Okay, now lift this arm up, Bob. So you can see right here, he's got it there. Now, you should feel some pretty immediate relief, or sometimes it's that it hurts, but it hurts so good, it feels like it's gonna pop. And it's very common, you will get it to cavitate or crack. You will hear and feel your back crack when you do this.
You might even move up and down on it a little
Yeah,
bit.
exactly. You may have to adjust like Bob is doing here.
Now, we should warn you though, if this is too much, if this is too aggressive for you, then you shouldn't do it.
Right.
I mean,
I'll be honest with you, if
it's
you're
not for everyone.
if you're a sedentary person and you don't do a lot of activity or exercise, it's probably going to be uncomfortable and
It's
will
gonna
not
be too
work.
much for you.
Right. Let's go to the next option.
Yeah, the better option,
The
really.
better option, if you find some success with that, or you don't mind going online and get a 6-inch foam roll. If you go OPTP, that company will have good quality rolls.
OPTP.com.
.com,
Yep.
or Amazon has
Yeah,
them.
Amazon foam rollers,
Yeah.
just put in there.
But here we go, 6-inch foam roller. There's densities. They make some softer
They
ones
make
actually.
densities, they got different textures now on them too.
Right.
They got rollers and stuff.
I would just get the standard one to start out with, and the firmer density. And about $15, $20 you can get a 1-foot long one, which is good for the thoracic spine. We're going to do this on the floor because it will not roll good on something soft. Carpeted floor works good. You got me, Lonnie? Okay. Now, I'm convinced personally.
Together.
Oh yeah, keep our carpets together. We gotta get that guy in here and sew those up.
Yeah.
I'm convinced, now I'm gonna start here, my low thoracic spine, and I'm just gonna roll. Oh, did you hear that?
No, I didn't.
Oh, I felt it. That baby cracked nicely. And all the way up to my neck. And I was just telling Bob, I got off my bike the other day and I keep this in my garage. And I laid it down on the concrete, and I did it right after I got off my bike because I was going for a run right after that. And I had about a half a dozen cracks in my back, and psychologically it's wonderful and it does good for your back as well. And I was able to run quite well. A lot of times running off a bike is hard. Oh yes. So you're going to spend about that much time and you're done.
Yeah, simple treatment. Again, not for everyone. You may want to try the towel first to see if you can even tolerate that.
Right.
If you can't, you're not going to probably be able to tolerate this.
Right,
So.
but I'm convinced that this is superior over the towel. Bob and I were talking about that, but
Right.
I really like
Brad's always right, so
Sorry, Bob, but it really
you
works.
can't help it. He's always right. Take care.
The towel is junk compared to this.